Hi, it's Dr. Deal here again with another case study. I apologize, I haven't done any for a while. I've been having problems with my camera, but I decided to go ahead and do this one anyhow because it was that important. This is unfortunately something I see way too often, and it really gets me upset and breaks my heart at the same time because I see so many people that have been suffering needlessly for many years because they aren't getting the proper diagnosis or treatment. And as in any patient, that involves doing a good and thorough history. And because of the extensiveness of our paperwork, oftentimes I have a pretty good idea what's going on with someone before I even see them, where I have very strong suspicions, and that's because we take the time to review their medical records. So this case study I'm going to do a little bit differently. I just actually had seen this patient, and I'm going to tell you what I expect to find, and we'll see whether or not I'm right. And this is all in the course of about a half hour, 45 minutes. I believe I'm able to help a patient that has been neglected through the traditional medical management for many years, to the point to which at 32 years old she's legitimately disabled. And again, it's very sad, and I see it way too much. And that's because no one takes the time to tie all the pieces together. So I'll tell you, this patient consulted with me with fibromyalgia. That's one of several diagnoses which she had received. Some of the others were Sjogren's, possible ankylosing spondylitis, irritable bowel syndrome, which, by the way, is not a diagnosis, and it's a joke. I would be embarrassed as a physician to diagnose someone with IBS. More like, I can't figure you out. And it's frustrating, trust me. Depression, anxiety. So she's had these bowel or digestive issues for many years. What happens when you have digestive problems is it leads to inflammation, which eventually becomes systemic. It can influence hormones and neurotransmitters, leading to depression, anxiety. It can be a trigger or a precursor to autoimmunity, which we know she already has one autoimmune condition, Sjogren's, and suspected of having a second, ankylosing spondylitis. So these gut issues could tie together all these other different diagnoses. She also has a lot of symptoms of low thyroid. She's been told in the past it's kind of low, but not enough to really do anything about. But we're going to do a more thorough blood workup, and I would guess that she does have thyroid issues, seeing as how most thyroid problems are autoimmune in nature. So we're going to check for those antibodies, and I'm not going to guarantee, but I suspect that we'll find those antibodies indicating Hashimoto's, because once you have an autoimmune condition in which your bodies begin targeting and attacking healthy tissues, there's nothing to prevent it from going out and seeking, targeting, and destroying other healthy tissues. So that's why, from a functional medicine standpoint, it's imperative that we identify any of those underlying triggers which are causing this to happen. Many times with Hashimoto's or autoimmune thyroid, which many of our fibromyalgia patients turn out to be, there's food sensitivities that are not going to be detected using traditional blood testing. But these food sensitivities can serve as a trigger to gut inflammation, to hormone imbalances, neurotransmitter imbalances, and autoimmunity. So again, we're going to do a more thorough thyroid panel. We're going to look at things that influence immune health, like vitamin D levels. And I also suspect to find, or have a high suspicion that we may find, that this young woman has an MTHFR genetic mutation and or methylation issues, which again predispose her to hormone problems, neurotransmitter problems, allergies, autoimmunity. So by doing more thorough blood work and having a better understanding on how all these systems and all these conditions tie together, we are going to be able to help her. But it's sad that it's taken 32 years of her life for this to be done. And many people, it's much later than that. So I look forward to sharing with you here, maybe in about a week when we have the blood work back, what we found and how we're going to be able to help change this young woman's life. If you or anybody else you know suffers from a chronic, difficult to understand or difficult to diagnose health problem, I invite you to share this with them or call our office, at least sit down for a consultation where we can review your medical records and find out whether or not we can help you. Thank you for listening and have a great day.